Have you ever trusted a doctor so much that you didn't even think twice before agreeing to a surgery? What if I told you that some of the most common surgeries recommended to seniors might actually do more harm than good, even become life-threatening? Stay with me, because what I'm about to share could literally save your life, or the life of someone you love. Hello, I'm Dr. Adewale, and today we're diving into a topic that most people don't talk about openly. As we age, our bodies change. Healing slows down, risks increase, and decisions that once seemed routine suddenly carry serious consequences. Yet, every day, thousands of seniors are being advised to undergo surgeries that may not be necessary, and in some cases could be downright dangerous. Now, don't get me wrong. Modern medicine has done incredible things. Surgeries save lives every single day. But here's the truth. Not every surgery is worth the risk, especially in older adults. And the most dangerous part? Many people agree to these procedures without fully understanding what they're signing up for. So today, I want to walk you through 5 surgeries that seniors should think very carefully about before saying yes. This is not about fear, it's about awareness, empowerment, and making informed decisions. Let's start with something very common: knee replacement surgery. Knee pain can be unbearable, especially as we age. You wake up stiff, climbing stairs becomes a struggle, and even walking to the kitchen feels like a chore. So when a doctor suggests a knee replacement, it can feel like a lifeline. But here's what many people don't realize. Knee replacement surgery is a major operation. It involves cutting into bone, inserting artificial components, and a long, demanding recovery period. For seniors, the risks are significantly higher. Blood clots, infections, complications from anesthesia, and even heart issues can arise. And here's the shocking part. Studies have shown that not all patients experience significant improvement after the surgery. Some still deal with pain, stiffness, or limited mobility. What's worse is that recovery can take months, and not everyone regains full function. In fact, some seniors end up less mobile than they were before. That's a tough reality. Now, I'm not saying knee replacements are always bad, but they should never be your first option. Physical therapy, weight management, low-impact exercise, and pain management strategies can often provide relief without the risks of surgery. Let's move on to another one that might surprise you: spinal fusion surgery. Back pain is one of the most common complaints among older adults. It can be constant, draining, and deeply frustrating. So when surgery is offered as a solution, it can feel like hope. But spinal fusion is one of the most controversial procedures out there. This surgery involves permanently connecting 2 or more vertebrae in your spine, eliminating movement between them. While that might sound like it would stabilize the spine and reduce pain, the reality is often very different. For seniors, spinal fusion can lead to serious complications. Infection, nerve damage, blood loss, and prolonged recovery are just the beginning. But even more concerning is that the surgery doesn't always relieve pain. In fact, some patients experience new pain or worsening symptoms. And because the fused section no longer moves, it puts extra stress on the surrounding areas of the spine. Over time, this can lead to additional problems and even more surgeries. Many experts now believe that spinal fusion is overused, especially when less invasive treatments could be effective. Physical therapy, targeted exercises, and lifestyle adjustments can often make a significant difference without the risks of surgery. Now let's talk about something that's often considered routine: gallbladder removal. Gallstones can be incredibly painful, and gallbladder surgery is one of the most commonly performed procedures. But here's what many seniors aren't told. Not all gallstones require surgery. In older adults, surgery carries higher risks, including complications from anesthesia, infections, and digestive issues afterward. And while removing the gallbladder might solve the immediate problem, it can lead to long-term digestive discomfort for some people. The truth is, many people live with gallstones without ever needing surgery. If the symptoms are mild or infrequent, careful monitoring and dietary changes may be a safer approach. But too often, Surgery is recommended as the default option, without exploring less invasive alternatives first. Now here's one that might hit close to home: heart stents. When someone hears that their arteries are blocked, it's terrifying. The idea of a heart attack looms large, and placing a stent can feel like an urgent, life-saving decision. But here's the reality. In many cases, especially for stable heart disease, stents may not provide the benefits people expect. For seniors, the risks of complications from the procedure, including bleeding, infection, and adverse reactions to medications, can be significant. And research has shown that for many patients, lifestyle changes and medication can be just as effective as stents in preventing heart attacks. That's right. Sometimes a healthy diet, regular exercise, and proper medication management can do just as much, if not more, than a surgical procedure. But because stents are seen as a quick fix, they're often recommended without fully discussing these alternatives. Now let's talk about the fifth and final one: carotid artery surgery. This procedure is designed to prevent strokes by removing plaque buildup in the arteries that supply blood to the brain. It sounds like a smart preventative measure, but for seniors, the risks can be quite serious. Stroke, heart attack, and even death can occur as complications of the surgery itself. And here's the critical point: not all patients with carotid artery narrowing actually benefit from surgery. In many cases, medication and lifestyle changes can effectively manage the condition without the need for invasive procedures. But again, surgery is sometimes presented as the best option without fully considering these safer alternatives. Now I want you to pause for a moment and think about this. How many times have you or someone you know been told that surgery is the only solution? It's a powerful statement. It creates urgency, fear, and a sense that there's no other choice. But the truth is, you almost always have options. And that brings me to something incredibly important: second opinions. If there's one piece of advice I want you to take away from this video, it's this: never agree to a major surgery without getting a second opinion, sometimes even a third. Different doctors have different perspectives. Some are more conservative, while others may lean toward surgical solutions. By seeking multiple opinions, you give yourself the chance to explore all your options and make a truly informed decision. And don't be afraid to ask questions. Ask about the risks, the benefits, the success rates, and the alternatives. Ask what happens if you do nothing. Ask how the surgery will impact your quality of life. Because at the end of the day, that's what matters most: your quality of life. As we age, the goal isn't just to live longer, it's to live better, to stay active, independent, and able to enjoy the moments that matter. Sometimes that means saying no to a surgery that carries more risk than reward. Now I want to be very clear. This video is not about rejecting medical advice or avoiding necessary procedures. There are times when surgery is absolutely the right choice, but those decisions should be made carefully, thoughtfully, and with a full understanding of the risks and alternatives. Too often, seniors feel pressured to agree to procedures because they trust their doctors or fear the consequences of saying no. But you have a voice. You have a right to understand, to question, and to choose what's best for your body. And if something doesn't feel right, trust that instinct. Let me leave you with this. Your health is not just about treatments and procedures. It's about lifestyle, prevention, and making choices that support your well-being every single day. Simple things like staying active, eating a balanced diet, managing stress, and keeping up with regular checkups can go a long way in reducing the need for invasive procedures in the first place. So, before you agree to any surgery, take a step back, breathe, ask questions, explore your options, because sometimes the most powerful decision you can make is to say no. If you found this video helpful, share it with someone who might need to hear this message. It could make all the difference. And remember, I'm Dr. Adewale, and I'm here to help you take control of your health, one informed decision at a time.